think we I didn't want to cut that off because I thought that was such an important discussion, but I don't think we have time for questions now. So if you all have questions for this panel, maybe you can search them out during one of our breaks, or we can address it a little bit more at the wrap-up this afternoon. I think we need to move ahead to the co-benefits to human health, which is going to add on top of the health considerations some of the socioeconomic and community and other considerations. So welcome Jonathan up here to moderate the next panel.
Good morning, everyone. If our speakers could come up, appreciate it. Welcome to the Co-Benefits to Human Health session. We're going to be looking at how an understanding of the built environment's human health impacts can effectively be used as a basis for design. This session includes people involved with health who will talk about how they're applying their research and goals to the built environment, and people in the built environment who will talk about the challenges of getting and applying evidence-based health research into practice. We're going to keep things moving quickly so we have time for more questions and discussion at the end after the presentations. And if you'd like more information about our panel members who will say a few words about themselves, check out the website, and you can also Google us too. I've shortened my presentation by cutting out all the jokes I usually tell. So, well, there are a few, okay. As you've heard this morning, we can design, build, operate, and maintain our buildings and communities in ways that promote positive psychosocial and health outcomes. But while we're making the human health connections here, in practice, little of this is well-established evidence-based research is being translated into mainstream design and construction. We're making progress toward establishing a human health baseline for design with positive human and environmental health outcomes at the heart of design standards and rating systems. But how can we be sure that they won't be discounted or ignored at the end of the road when social and environmental factors meet our economic decision-making process? Today, these considerations rarely make the cut, and they're usually left behind. Here's a quick look at some of the reasons. And I should say, by way of introduction, I'm an architect, but that doesn't prevent us from talking about practically anything at all. So I'm going to be talking about economics. Our classical economic paradigm sees the economy as an abstract entity separate from the natural world. The environment has no value except as a source of raw materials and as a sink for wastes. Human health has no place in this model, and society's only value is as a source of human capital as reflected in labor costs. This may look familiar. Traditional economics says that when markets are functioning properly, an equilibrium price and quantity will emerge naturally, leading to socially optimal conditions as if guided by an invisible hand. All that's necessary is informed and logical consumers and producers, truly competitive markets, and accounting for all direct and indirect impacts like illness or pollution. But back here in the real world, these conditions are seldom present together, and we get a marketplace that's not efficient, doesn't allocate our resources in a socially optimal manner, and where impacts of our transactions are passed on to others. To explain this problem, economists have created the concept of market failures. Market failures include public goods, which the market has no incentive to produce because they can't be bought or sold, and anyone can use them. Public goods like climate regulation are often overexploited by consumers and businesses that benefit from their use and diminish their well-being without paying for them. This can lead to the negative health and societal impacts that we're talking about here today. Externalities are another type of market failure that occur when the impacts of goods or services, positive or negative, are passed to others. If a designer specifies resilient flooring because of its ease of installation and low price, but doesn't consider the dangerous cleaning products that must be used to maintain it, a negative externality is created as occupants and maintenance workers are exposed to toxins after the building is occupied. The facility owner benefits directly from the cost savings, but the indirect impacts on health and productivity are borne by the building users. Alternatively, when a highway department installs an electronic toll collection system to reduce traffic congestion and staffing, they don't benefit from the lower emissions from reduced idling. The department benefits directly from the lower operating costs, but it's the nearby mothers and society as a whole who benefit from the reduced negative health impacts on mothers and children. Externalities are very important to understand, since economic analyses, when not omitting them altogether, often weigh negative social and health impacts that are difficult or impossible to price against easily priced costs such as industrial or other production. Our most common economic analysis tool is cost-benefit analysis, which compares the total expected costs against the expected benefits to determine the best investment choice. Its attraction is its perceived ability to reduce complex policy decisions by monetizing and summing them up in a single number. Since it was applied to federal water projects in 1902, it's been adopted for most other capital projects in the federal government as well. President Reagan required cost-benefit analyses of proposed regulations before they could be issued, and later President Clinton applied cost-benefit analysis to most federal programs with a few adjustments. But this approach seldom even considers externalities of health and quality of life, and pricing them can be problematic at best. And since traditional economists seldom interact with health economists, the results are often twisted. In 1997, a Harvard law professor argued that cigarette smoking should not be discouraged, since the savings from smokers spending less time in nursing homes and collecting less retirement was greater than the cost of their medical care and life insurance. Can anyone see the problem here? Another problem with cost-benefit analysis is that it favors the lowest first costs, which don't always make sense over time. In response, concepts like present value and life cycle cost analysis were developed. Again, this was another government innovation. In 1933, the USDA introduced the idea of life cycle cost analysis when they bought tractors based on a total cost after 8,000 operating hours, rather than just the first cost. But the way that we apply it, life cycle cost, is considered a gate-to-gate approach. It doesn't concern itself with activities before acquisition or after disposal, including the social and environmental impacts. Eventually, international environmental movements began to insist that businesses find ways to consider their social and environmental impacts, which today the most popular approach is the triple bottom line. The triple bottom line is intended to look beyond simple economic bottom line and puts society and the environment on a seemingly equal basis. But limited areas of overlap suggest that large areas of each subset have no relationship to the others. The federal government also has called for a similar approach dating actually back to NEPA in 1969, and it's reiterated in the recent Executive Order 13514. But what happens when you put this seemingly more responsible approach into the same economic decision-making process that we've been talking about? Not to put too fine a point on it, predictably, when environmental and social impacts of investments must still be identified and priced to see whether or not they can pay their way in order to survive, you get results consistent with those that got us here today. But protecting public health can't be treated on just an economic basis. The Clean Air Act would not have passed a cost-benefit test in 1970 before we understood the negative health impacts of fine particulates. Still, at the time, evidence showed that air pollution damaged human health and that action was required. So how can we begin to overcome these limitations? We can start with a paradigm that defines the economy as a construct of society that moves goods and services through it while determining what has value and is economically viable. In this ecological economics model, the economy can only be sustained if there are healthy societies living in healthy ecosystems, operating within the Earth's finite limits, distributing resources so that all can live with respect, and using the marketplace appropriately for efficient allocation. In this way, human and environmental health move to the front of the line. Ecosystems that provide life support are strengthened, renewable resources are consumed below their regeneration rates, and wastes and toxins are minimized or eliminated. This is the foundation for long-term sustainability. The challenge is to get these core ideas into mainstream practice. Our current approach alone is not going to work. We need to get professional judgment back into the decision-making process through a multi-criteria, multidisciplinary approach like the ones we're discussing here today. And we have to find a common language for health professionals, health and non-health economists, and design professionals to communicate with so that achieving positive human health outcomes becomes the basis for design of our buildings and of our communities. Our next speakers will be talking about the connections between the built environment and health and how we can make science-based health considerations central to the broader conversation. And you'll see elements of ways of expanding the professional judgment part, which the slide that you saw, this is in an Office of Management and Budget instructions, and it doesn't seem to be really in common practice, at least in the federal government. So thank you, and our next speaker is Janet.